You tell me.
All right, so I have a very nice lady here who is a few months out from having Odyssey multifocal lenses in both eyes, and I just wanted to share her case because I think it's a little bit interesting. So you have a history of RK in both eyes.
Right.
Yeah, which conventional wisdom would I think it would be fair to say a lot of doctors would discourage multifocals in RK patients, or even blanket across the board rule it out. And in fact, I would describe myself as even being relatively conservative with RK patients getting multifocals. But this patient has done awesome. You are 20/20 in both eyes at distance. You're, for just nerdy doctor speak, for those who care, she is plano in her right eye, and her left eye is -1/4. She has probably about 1/4 of a diopter with the rule cylinder in her left eye, which she will age into nicely. That will likely soften as she gets older. But you might say, well, why in the world did we offer multifocal to this patient if we're sometimes a little bit conservative with multifocals in patients with a history of RK? Well, I think there is two important things to point out. For one, your RK was super regular. When we looked at your corneal maps, it was a very normal looking corneal map. You didn't have a lot of higher order aberration. It just was a good, simple, it was 8 cuts per eye, but your corneal topography looked great. It was very regular. The second thing is that you had a history of doing contact lenses with multifocals, isn't that right?
Right.
Yeah, and so when you were sent to me, you kind of had a thought that you would do light adjustable lenses like your sister had, and she was very happy with that, doing monovision. But we talked to you and you said, well, you know, I've tried monovision contacts and I didn't like it as much as I like my multifocal contacts.
Right.
So we had you come out of your contacts for a little while and let your eyes breathe for a few days or weeks or so, and we got really good measurements on you, did multiple measurements and did good post-RK calculations, and went for it with an Odyssey multifocal. And you're using glasses now?
No, not at all.
No glasses. Tell me what that's like.
No reading glasses. Heaven.
Yeah. When was
I
the
love
last
it.
time you didn't need, when was the last time before this that you didn't need reading glasses?
Never.
20 years
Not
ago?
before this, right.
Yeah, okay.
Since I was in my 40s. It's
Yeah,
been a while.
yeah. So, and you did say that you could imagine using readers to like see like a medicine bottle, like
Right,
something
like
very tiny.
super.
But for practical purposes, you
Right.
feel like you don't need glasses anymore.
Not at all.
And you would describe
I
yourself
can
as
see the computer, I can see books to read, I can see far away.
you can drive.
So it's working
And you would
great.
describe yourself as happy and glad that you did this.
Right.
Okay.
I can
Yeah.
chop vegetables and not worry about cutting my fingers off.
I
so.
love it. One other thing I'll
love
say, I think particular to the Odyssey lens, if you dig into the data with its clinical trials and data that's been put out about the Odyssey lens, it tends to be a little bit more forgiving with slight refractive errors, residual glasses prescriptions, which sometimes an RK patient is going to be more prone to having some residual refractive error. Well, in the Odyssey lens, patients tend to still be 20/20 even with modest refractive errors. Now that's not true for everyone, but I think it's fair both in the company's data as well as in, and by the way, I have no financial interest with this product other than I benefit from happy patients, maybe you could say, but I don't have any relationship with the company that makes this product, but I do happen to like it. But I think that particular multifocal lens is more tolerant to subtle residual refractive prescriptions. So in an RK patient, if you think they're going to be more likely to have a refractive error, they sometimes will do better with an Odyssey multifocal. And I think, you know, in your case, we still hit the nail on the head, but my point is that gave us a little bit more freedom to go for an Odyssey multifocal in you because you liked it in contact lenses, you had very regular topography, and you had very reasonable expectations. We even had a plan that if for any reason you didn't like it, we could take it out and put in alternative lens, similar to what your sister had. But at any rate, just thought it was a neat case to share. There are very happy patients like this one out there who are doing awesome. Anything else you want to say?
I'm just extremely happy I had it done.
Yeah.
It's well worth it.
All right. Thank you so much.